Welcome to the Deep Dive, where we cut through the noise and get straight to the essential insights. Today, we're taking a journey into a topic that, well, it might seem a bit niche, maybe just for the livestock community, but trust me, its reach is surprisingly broad. We're diving deep into Porcine Erysipelas. It's a significant disease in pigs, absolutely, but its implications ripple out, even directly impacting human health.
That's exactly right. For this deep dive, we've looked at some pretty comprehensive research, clinical overviews, things focusing on the disease itself, how it's controlled, the diagnostic methods.
Okay.
Our mission today really is to distill the most critical takeaways from this widespread infectious challenge.
Right.
You'll hopefully walk away understanding its surprising impact and the clever strategies we use to manage it, and that includes its often overlooked connection to our own health.
Okay, so let's pull back the curtain then. What exactly is Porcine Erysipelas?
Okay. At its core, it's a major bacterial infection. Primarily affects swine, pigs. The culprit is this pretty tough little bacterium called Erysipelothrix Rhusiopathiae.
Rhusiopathiae, okay.
Yeah, it's found basically all over the globe, and it can hit pigs of any age, really.
Any age.
Yeah, though, we most often see it crop up in growing pigs and adult pigs.
Got it.
And this disease, it can really hit farmers hard. We're talking significant economic losses. Sick animals, treatment costs, and just a big drop in productivity overall. And like you hinted, that zoonotic potential means it's not just an animal health issue. It poses a very real risk to humans, too.
And what's particularly interesting, it may be a bit tricky, is that it doesn't always look the same, does it? It can show up in pretty different ways.
Exactly. It's not one size fits all. You can have these acute, really severe forms.
Okay.
Then there are milder, sort of subacute cases, and even chronic long-term problems stemming from it.
Right. So let's talk about the bacterium itself, Erysipelothrix Rhusiopathiae. You said it's tough.
Yeah.
Here's where it gets truly interesting, I think. It's resilience.
Yeah.
You're saying this thing can survive in the environment for quite a while.
For surprisingly long periods, yes. Which makes it, a persistent and kind of sneaky threat.
How pervasive are we talking?
It's basically everywhere.
Yeah.
Truly ubiquitous.
Wow.
You'll find it globally. In the soil, in food scraps, in water sources.
Okay.
And what's more, it can be carried by a whole host of other animals. Think birds, rodents, various other mammals.
So they act like carriers.
Exactly. They can all act as these hidden environmental reservoirs for the bacteria.
And here's the part that, well, it kind of blew my mind when I was reading up on this.
Yeah.
Up to 50%, half of perfectly healthy-looking pigs can be carriers.
That's the statistic, yeah. Up to 50%.
I just have it in their tonsils, not showing any symptoms.
Correct. Harboring it in their tonsils, looking completely fine. So you have these seemingly healthy animals, and they are, in fact, a primary source of infection. They're shedding the bacteria in saliva, urine, feces.
So that really changes things, doesn't it? You can't just look for sick pigs.
Exactly. It fundamentally changes how you have to approach control. It means looking for sick animals just isn't enough.
Right.
These invisible carriers, they make those comprehensive sort of herd-level strategies like vaccination absolutely essential. It forces us to rethink what healthy even means on a farm sometimes. Now, the main way pigs usually get infected is just by eating contaminated feed or drinking tainted water.
Okay, ingestion mostly.
Mostly. But don't underestimate skin abrasions, little cuts or scrapes. Those can also be entry points for the bacteria.
Okay, so with all these healthy carriers walking around and it being in the soil and water, what actually pushes a herd from just, carrying it silently to a full-blown outbreak? What are the triggers?
That's a great question. And often the answer is stress.
Stress, like what?
Well, things like transportation stress, sudden changes in their feed, extreme weather conditions, heat stress, cold stress. Those can all trigger it. Poor hygiene is another big one. If the environment's heavily contaminated, that increases the bacterial load, and it can just overwhelm an animal's natural defenses.
Makes sense.
And also, if pigs are already fighting off some other infection, something that weakens their immune system.
Right, they're more vulnerable.
Exactly. They become much more susceptible to erysipelas then.
So when this disease does take hold and you start seeing symptoms, what does that actually look like? How does it present?
Right. The clinical signs really depend on which form you're dealing with. Let's start with acute erysipelas. That's the most severe.
Oh.
It often comes on very suddenly. You'll see a high fever, like really high, usually 104 to 108 degrees Fahrenheit.
Wow. That's 40 to 42 Celsius.
Exactly. The pigs get lethargic, really don't want to move. They often have this stiff, painful way of walking.
Painful gait.
Yeah. But the absolute classic sign, the one that really makes you think, this is probably erysipelas, is the skin lesions.
The diamond skin lesions.
That's them. Raised, diamond-shaped lesions on the skin, usually red or purple. And yeah, they're aptly named diamond skin disease.
Can't miss those, I imagine.
Pretty distinctive, although in the most severe cases, sometimes sudden death is actually the only sign you see.
Oh, wow.
And that high fever, it can also cause pregnant sows to abort their litters.
Right. The fever itself is dangerous. Okay, so that's the acute form. What about the subacute? You said it's milder.
Yeah, subacute erysipelas is generally less severe. Pigs might just have a temporary fever, maybe go off their feet a little bit.
So less dramatic.
Much less dramatic. Those diamond skin lesions might still show up, but often they're much less obvious, less pronounced. Sometimes they get missed entirely.
Okay. And the third form, chronic.
Right. Chronic erysipelas. This usually follows an acute or subacute episode that maybe wasn't fully resolved or just develops over time.
Okay.
The most common feature here is chronic arthritis. You'll see swollen, painful joints, lameness, a real reluctance to stand up.
That sounds debilitating.
It really is. It's a major welfare issue and obviously impacts growth. But critically, the bacteria can also travel to the heart valves.
The heart.
Yeah, they can colonize the heart valves, leading to something called vegetative endocarditis.
Endocarditis.
Which basically means growths on the heart valves, leading to poor circulation, exercise intolerance, and eventually it can cause heart failure. And pigs with this chronic form, they often just don't grow well. Their overall productivity is significantly reduced.
Wow. Okay, those diamond skin lesions really do sound like a key identifier, almost a saving grace for diagnosis compared to some of the other signs.
They are definitely a very strong indicator, yes. A big red flag.
So, given how fast that acute form can hit, maybe even cause sudden death, how do veterinarians actually confirm it's erysipelas? And once they know, what's the plan? What's the treatment?
Well, like we said, a presumptive diagnosis is often made right there on the farm based on those typical clinical signs, especially the diamond skin lesions if they're present.
Right, the visual clues.
Exactly. But for a definitive diagnosis, you really need laboratory confirmation. That's vital.
How do they do that?
We're talking about taking samples, maybe blood, fluid from swollen joints, or tissue samples, and doing a bacterial culture, trying to grow the Erysipelothrix bacteria.
Oh.
Or, increasingly common now, using rapid PCR assays. These look for the bacterial DNA directly, which can be faster.
PCR, right.
And post-mortem examination, if an animal dies, can also be really revealing. You can see characteristic lesions, especially in sudden death cases, or if you suspect that chronic heart valve issue, the endocarditis.
So it really underscores the need to act fast, especially with the acute form.
Absolutely. Speed is important.
What's the go-to treatment once it's confirmed or even strongly suspected?
Penicillin. That's really the antibiotic of choice.
Penicillin, okay.
It's generally highly effective against Rhusiopathiae. Still works very well in most cases. Other related antibiotics, other beta-lactams, can also be used.
And do you just treat the sick ones?
That's a key point. In an outbreak situation, it's often necessary and definitely recommended to treat the entire affected group of pigs.
The whole group? Even the ones that look okay?
Yes. To get ahead of the spread, minimize the severity in pigs that might be incubating the disease, and just generally contain the situation. Remember those silent carriers.
Right. Treat the visible and the invisible threat.
Precisely.
Okay, so thinking about prevention now. Given how widespread this bacteria is, the carrier state, the economic impact, what are the best ways to keep erysipelas off the farm, or at least keep it under tight control?
Yeah, prevention is key, and it really has to be a multifaceted approach. You can't just rely on one single thing.
Makes sense.
But the absolute cornerstone of any erysipelas control program is vaccination.
Vaccination, okay.
We have good vaccines available, both inactivated or killed vaccines, and also live attenuated vaccines.
And they work well.
Yes, they've proven highly effective. They significantly reduce both the number of cases, the incidence, and also how severe the disease is when it does occur.
So who gets vaccinated and when?
Good question. Schedules are usually tailored to the farm, but typically you vaccinate the breeding stock.
Sows, gilts, boars.
Exactly. So gilt before they're bred and the boars. The goal there is for them to build strong immunity so they can pass maternal antibodies to their piglets through the colostrum, the first milk.
Gives the piglets some protection early on.
Right, a head start. Then In herds, where erysipelas is a known persistent problem, you'd also vaccinate the growing pigs themselves, usually around or after weaning, for their own direct protection.
Okay, vaccination is number one. What else?
Beyond vaccination, robust biosecurity and management practices are absolutely non-negotiable.
Biosecurity. That's always crucial.
Always. Things like using all-in, all-out production systems, meaning you completely empty a barn or room, clean it thoroughly, disinfect it properly, and let it dry between groups of pigs.
Breaks a cycle.
Exactly. It breaks the disease cycle, reduces the buildup of bacteria in the environment. Quarantining any new animals coming onto the farm is also critical.
How long?
Minimum 30 days, ideally. Keep them separate before they join the main herd. Helps prevent bringing in new infections.
Good practice.
Then there's effective rodent and bird control. Remember, they can be carriers.
Right. Minimize those external sources.
Yeah, and just general thorough cleaning and disinfection of all the facilities, the equipment, feeders, waterers.
Diligence.
It takes diligence. And one more thing, culling chronically affected animals, those ones with the persistent arthritis, for example.
Why cull them?
Because they can act as persistent sources of infection. They might keep shedding the bacteria and just keep reinfecting the rest of the herd, even with vaccination in place.
Got it. Remove the constant source.
Exactly.
Okay, this brings us to a really important connection. You touched on it earlier. Let's connect this to the bigger picture. What does all this mean for human health? How does Porcine Erysipelas actually affect us?
Yeah, this is a vital point for people to understand, especially those working with pigs. Erysipelothrix, Rhusiopathiae, is, as we said, a zoonotic pathogen.
Zoonotic, meaning it can pass from animals to humans.
Correct. In humans, the disease it causes is known as erysipeloid. Not to be confused with erysipelas, which is usually caused by strep bacteria in humans. This is erysipeloid.
Erysipeloid. Okay, and who's most at risk?
It's primarily considered an occupational disease, so it mainly affects individuals who have frequent direct contact with animals or animal tissues.
Like veterinarians, farmers, slaughterhouse workers.
Precisely those groups, abattoir workers, butchers, fish handlers too, actually, as the bacteria can be found in fish slime as well.
Interesting. How does the infection typically happen in people?
Usually the bacteria enter through small cuts or abrasions on the skin.
So like that skin entry route in pigs.
Exactly. Often occurs from direct contact with infected animals, their tissues, or maybe contaminated environments like knives or surfaces in a processing plant.
And what does erysipeloid look like in a person?
It usually presents as a localized skin infection, typically a painful, slightly raised purplish lesion. Often on the hands or fingers, given how infection usually occurs, it tends to spread slowly.
Painful, purplish, on the hands. Okay, is it serious?
The localized form usually responds well to antibiotics, similar ones used in pigs, like penicillin. Systemic infections where it spreads through the body are relatively rare in humans.
But possible.
But possible, yes. And if they do occur, they can be serious, potentially leading to things like endocarditis, just like in pigs, or septicemia. So prompt treatment is important.
That really raises a critical awareness point then, doesn't it? For anyone working closely with swine or even fish or poultry, that tiny cut you barely noticed, it could be an entry point.
Absolutely. It really underlines the importance of good personal hygiene, washing hands thoroughly, and using protective measures like gloves, especially if you have any breaks in your skin.
Simple precautions, but vital. Well, we've just taken quite a comprehensive journey, haven't we, through Porcine Erysipelas, from understanding this remarkably resilient bacterium itself.
Yeah, it's a tough one.
To its broad impact, not just on animal health and farm economics, but on human well-being, too. It's really a powerful testament to how interconnected all these systems truly are.
It really is. Nothing exists in isolation.
So as we wrap up, here's something, maybe a final thought for you, our listeners, to ponder. Considering the sheer resilience of this bacterium, E. Rhusiopathiae, how it can just hang out in the environment, and especially its unique ability to exist, almost harmlessly in healthy carrier animals.
Yeah.
How might our whole understanding of what's normal for the microbial presence on farms need to evolve? Maybe beyond just focusing on disease outbreaks. How can we better anticipate and perhaps mitigate future risks by really understanding these more hidden, complex microbial dynamics?
That's a fascinating question. Moving beyond just reaction to proactive understanding of the whole farm microbiome, definitely something to think about.